listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, the MAOEP can present options for your clients to switch their coverage. We are walking through some compliance practices you should be following during this particular season. Medicare Advantage Open Enrollment Do's and Don'ts, written by Isabel Vitale and Blaine Waterloo. At the beginning of the year, some of your clients in new Medicare Advantage plans give you a call. They're concerned about their plans. Changing health plans can make anyone feel uncertain as they transition from the known to the unknown. What happens when someone makes the move to try out a Medicare Advantage plan for the first time, or switches health plans, and then feels like their new coverage is not the right fit? Luckily for them, they're not stuck with their new coverage. Almost immediately after the annual enrollment period, beneficiaries in Medicare Advantage plans have an option to reconsider their plan selection. Here's what you need to know about the Medicare Advantage Open Enrollment Period, or MAOEP for short, and the important do's and don'ts that will keep you compliant. First, let's look at Medicare Advantage OEP qualifications. According to the Centers for Medicare and Medicaid Services, or CMS as we refer to them, the open enrollment period that most accurately applies to your clients hoping to switch plans after AEP is the Medicare Advantage OEP if they qualify. The MAOEP is specifically for clients new to Medicare who enrolled in an MA plan during their initial coverage election period, or ICEP. These beneficiaries have a 3-month individualized OEP that starts with the month they're entitled to Parts A and B. For example, if your client's Part A and B eligibility begins on June 1st, then they have June, July, and August to make certain changes, which we'll explain further on. The MAOEP is also for those who enrolled in MA plans as of January 1st. For these clients, there's an OEP from January 1st to March 31st. This means that your clients calling you early in the year who are unhappy with their new plan can make a one-time switch in coverage. But what can they switch to? They have a few options. Now, let's explore what enrollment changes you can assist your clients with during OEP. You can switch your client from one MA plan to another. Clients also have the option to drop an MA plan and return to original Medicare. Additionally, the client can enroll in a prescription drug plan, or Medicare Part D, if they return to original Medicare. Here are some things your client can't do. You cannot disenroll your clients with original Medicare from any accompanying prescription drug plans. You also cannot try to change a client's plan more than once, and you cannot try to enroll a client with original Medicare in an MA plan. It's important to remember the MAOEP was created for those with Medicare Advantage plans already. This means that your clients in original Medicare or MedSubs cannot use the OEP as an opportunity to enroll in an MA plan. Part D changes are also limited and depend on changes to the MA plan. Clients can change their drug coverage by switching from one Medicare Advantage prescription drug plan to another. By changing from an MA only to a Medicare Advantage prescription drug plan, or by returning to original Medicare and picking up a standalone Part D plan. Those with original Medicare and a Part D plan cannot switch to another drug plan during the MAOEP. They'll have to wait for an SEP or the next AEP. We covered what is and isn't allowed enrollment-wise. Now let's move on to the marketing do's and don'ts during the MAOEP. A big difference for agents between the AEP and the MAOEP is the restriction on marketing. Agents cannot knowingly target or send unsolicited marketing materials to MA or Part D enrollees during the MAOEP, which runs from January 1st through March 31st. It's important to note that knowingly takes into account the intended recipient as well as the content of the message. Here are marketing actions agents can take during the MAOEP. Agents can host marketing events focusing on plans other than Medicare Advantage or Part D, such as appealing to those aging into Medicare. Marketing based on the continuous special enrollment period beneficiaries have to enroll in a 5-star plan. Agents can reach out to dual eligible and low-income subsidy beneficiaries, since they may be able to change plans using an SEP. When marketing for the MAOEP, you can send marketing materials to a beneficiary who makes a proactive request. You can also hold one-on-one meetings with beneficiaries who request them and give out MAOEP information if a beneficiary asks for it. What about the things agents cannot do during the MAOEP? Agents cannot send beneficiaries unsolicited communications about the ability to make any additional changes or reference the MAOEP. Agents cannot target by way of purchased mailing list or any other means any beneficiary who's in the MAOEP because they made a decision during AEP. You cannot participate in or advertise any agent broker activities that address the MAOEP as a means of making more sales, nor can you contact former enrollees who chose a new plan during AEP. Agents should not use the MAOEP as an excuse to reach more clients you didn't get to see during AEP. That's not what the MAOEP is about. But something important to note here. If a beneficiary who has already made an enrollment decision unintentionally receives marketing information, that is not considered knowingly targeted. Here are some examples of things you should not communicate to your clients concerning the MAOEP. Don't like your new Medicare plan? Reach out to me about your disenrollment options. Did you know you can switch your MA plan from now until March 31st? Let's make an appointment. There's limited time to make an appointment and switch plans. You cannot use any of those statements about the MAOEP. Moving on to MAOEP coverage effective dates. Coverage on a plan chosen during the MAOEP begins the first day of the month following the month an MA company gets the enrollment request. For example, if a client enrolls in a different MA plan on March 3rd, their new plan's effective date would be April 1st. Another important note I would like to make here, the company in question can decide whether or not they're open to enrollments during MAOEP, which means your clients are not guaranteed a plan during this period. Make sure you know which of the carriers you represent allow enrollments during MAOEP before making recommendations. That doesn't mean your clients are stuck if this is the case. They may be eligible for multiple enrollment periods occurring within this one. For instance, they may qualify for an SEP, so it's possible their request for coverage will be accepted, but under a different coverage start date. We will end this episode by giving you something to think about. Ideally, before the MAOEP begins, you should have already reached out to your clients with a follow-up call, making sure they understand their plans and that they're happy with them. Follow-up calls are a great time to let clients know that you're available if they have questions or need further assistance. By doing so, you'll provide your clients with a feeling of security, and as a result, they'll be far more likely to refer their family and friends to you. Remember, if you're not contacting your clients throughout the year, Another agent may seize the opportunity to gain their trust. A client who has questions or is confused with their plan is far more susceptible to allowing another agent to write them into an MA plan the next time around. Protect your business. Don't let the hard work you put into AEP go to waste. While you're on call to assist your clients, here at Ritter Insurance Marketing, we are on call to help you succeed. If you're not already partnered with us, it is never too late. By becoming a Ritter agent, you'll gain access to our suite of online tools, exclusive trainings, and so much more. You can find the info to learn about registering with us in the episode notes, along with some other compliance resources. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Isabel Vitale and Blaine Waterloo. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen.